Welcome to the Strong for Life podcast. I'm your host, Conor O'Shea, and I really appreciate you tuning in. If you are enjoying these episodes, I'd really appreciate you taking a moment and rating it 5 stars on Spotify or on Apple or whatever podcast platform you use. This is going to allow more people to find this information. Without further ado, let's jump into today's show. All right, folks. So super excited to invite today's guest on the show. I've got Dr. Sarah Court, physical therapist, joining me today. Myself and Sarah have connected on Instagram, and I actually put up a post a few weeks back, and she just jumped in, told me basically that the research wasn't valid. Is it?
I jumped in and corrected you on the internet.
Yeah. And I think the biggest thing about it, it's a good place to start, is like you did it in a really friendly way. And I was like, oh, great. I didn't know that. You educated me. And it was all done in a really nice manner. So let's go into a bit more about your background first, and then we can kind of jump into the research side of things and kind of your approach with physical therapy. Because I think a lot of people listening to this have injuries, have chronic pain. I think they'll get a lot of value for what you've got to say. Okay.
Great. So I started as in the sort of movement world. I started as a yoga teacher about 20 years ago. Every time I have to do the math, I'm like, oh God, just getting older and older. And I loved being a yoga teacher, but I quickly ran into a lot of frustration because people would, come up after class and say things like, oh, it hurts my knee when I do this pose. And I had absolutely no knowledge of the body, really. I mean, it's, and this is a big thing about like yoga teacher trainings, and it's probably, outside the scope of what we're going to talk about today, but you don't get a lot of anatomy training. You certainly don't get any sort of training on like working with injuries. You're sort of told just like to tell the student, if it hurts, don't do it. So my response to everything for probably a couple of years was just, if it hurts, don't do it. But I found that very frustrating. I wanted to be more helpful. I didn't feel like a satisfying answer. So within the yoga world, I started to sort of study more and do more Con Ed that way. But then you sort of hit a upper limit because you're never actually working with people on their injuries. I was actually just talking about this today. There's the, like, let's say I have a sprained ankle right now, for example. So there is the rehab that has to happen for my sprained ankle. But then there's also all of my movement practice that I'm doing, that I'm trying to do as best as I can around it, right? So working out that sort of workaround part is the scope of the personal trainer or the yoga teacher or the Pilates instructor, the movement person. But the actual rehab of the ankle is the physical therapist or any other sort of clinician, right? And so I was very frustrated that I was only really working in the movement teacher realm and not in the actually helping the thing get better. And so then I decided to go to PT school, which was a pretty long process because I did it later in life. So I had to go back and do college level biology, physics, chemistry, statistics, other mathematics that I hated, like just so much. But then once I became a PT, I was really working with populations that I was interested in working with. And I find it, being able to help someone get out of pain is very satisfying, but also the sort of step past that, which is not just I'm getting you out of pain, but we're able to get you back to the thing that you're not doing right now because you are in pain, right? So it's yes, we made your knee feel better, but the consequences of that are you can now get down to the floor and play with your grandchildren. And that's the activity that you wanted to be doing that you weren't able to do, right? So that's really satisfying to get people back to the thing they want to do, or get people, sometimes I work with people who are just sort of like, yes, I have this knee thing, but I really want to run a marathon. And I'm like, great, we'll fix your knee and we'll start doing some training, So it's very satisfying in that way. It's a much broader population. And I work with people as well with chronic neurological conditions like multiple sclerosis, Parkinson's disease, things like that, So I really like what I do because it's constantly fascinating and no 2 days are the same.
Yeah, that's very, very cool. The fact that you were a yoga teacher, you saw like, okay, I'm not able to do this. I want to actually upskill and be able to do the thing that I'm currently limited with. And then you've done it now. So like, how long was that process to actually go back and go through all of those modules and everything?
Well, PT school itself is 3 years. And then to do all of the prerequisites, because I was I was about to say I was an adult, but I was working at the time, so I couldn't full time go back to school. So I did the prerequisites part time over 3 years. So the whole process was a 6 year event, and it was a
Yeah.
lot. After I finished it, I remember feeling like it was like someone had their thumb pressed up against the side of my head for 6 years, and then suddenly it went away, and I was like, "Whoa, wait a minute." But I do also remember thinking, I'm not sure I could do that again. Like that's a one and done kind of experience.
Totally. I actually have done two yoga teacher training courses,
Mm,
but in India, and they were like literally 4 week courses. And I remember the first one, I was like, we were doing a lot of backbending, it was Ashtanga. And I was saying to the teacher, hey, my lower back is really sore. This is like 8 years ago now,
mm,
2013. So yeah, 9 years ago. And the advice was just breathe through it. And then I
yeah,
asked like pretty high level Ashtangi practitioners who were in the class as well, like, what do I do? And they were like, oh yeah, just breathe through it. And that was it. And I was like, this isn't working. There was no like elevate your feet, or maybe it's your shoulders or thoracic spine. There was just people just clearly didn't know.
yeah. I mean, it depends, on the training, but certainly in the I was going to say traditional, but in the practice before it sort of became, diluted and turned into a lot of different things in the sort of Western version of the yoga practice, something like Ashtanga yoga or Iyengar yoga were not, they were not developed as a practice to rehab. They weren't developed in that sort of way. It was just, you just do the thing. And, in theory, if there's something that's bothering you, it will just adapt to what you're doing. But the difficulty is that a lot of yoga teachers, well, there's a lot of movement teachers, I think, don't have a real clear sense of where their scope of practice ends, and where it's not appropriate for them to be telling people to do things, or they just feel like they're, they take the answers that they heard and they pass them along. It's sort of like this game of telephone that happens. And as a result, ideally teachers are sort of in a situation where they recognize that they don't know what they don't know, but more often than not, there's sort of just very vague, like, well, try putting your arm here kind of things. It's not, they're just, I mean, I'm sure you experience this. There's just not sufficient training. The teacher training that all in the United States for Yoga Alliance, the teacher trainings only have to have 20 hours of anatomy, and that's it. So you have to kind of, I teach in a teacher training, and I really kind of pick and choose the points that I want to get home to people, so that I'm making it very clear what their scope is, but sort of big picture, like, hey, if you're doing backbending poses, keep an eye on this, or look at this kind of thing. But it's definitely limited. It's definitely limited.
Yeah. And like
Sorry, that's my
now,
dog.
that's okay. Are you currently coaching or teaching yoga now? And if so, like, how has your approach changed? Are you kind of on the fly mixing in PT with the asana practice? And yeah, would love to hear more about that.
Yeah, I teach like a couple of times a year. I'll teach a workshop. I don't generally teach. I don't teach weekly classes. But I do, teach every now and then. And I'm so sorry. I'm going to just pause for a second because she's going to be an absolute pain in the ass. Sorry, 1 second. Thank you. So I do teach some workshops a couple of times a year. I don't teach like a weekly class anymore. But even back when I did, I definitely pulled away from the sort of any sort of like a traditional framework of a class, and I'm much more interested in, and a lot of yoga teachers are kind of leaning this way, where instead of it being sort of a very like set, the way that Ashtanga is, where it's a set series of poses, and you have to get to this level and then you get to this next level, doing something where like the class focus might be something about like thoracic extension, and then using the yoga poses that are related to that, but also bringing in things like mobility, and bringing in things like cars, controlled articular rotations, and all of these other things that I've learned in PT, and also just from other mobility coaches and movement people. I mean, honestly, the I feel like it's cheating, but I just scroll through Instagram and I save the things that look cool and then I teach them. You know, and I'm like, am I cheating? Is this legal? But or you know, take something like that, practice it myself, find some spin-offs maybe, and turn it into like a series of movements or something like that. So it's to me it's more fun because I always enjoy the ability to, or the option to be more creative when I'm teaching and to pull other things in. But it just depends what you want to do. I mean, a lot of yoga teachers really do like teaching the sort of set, you know, for like series of poses, or they want to teach a class that is really primarily yoga asana and is not, you know, anything else. But I've never, to my knowledge, I've never had anybody be like, oh, I'm really upset that you had us do this like extra stretch, you know, or something. I think people generally appreciate that at this point we're kind of pulling things in from other modalities.
Yeah, like I did yoga for probably 3 or 4 years, and it was amazing because I hadn't any exposure to anything else. I was really stiff. I just played team sports, and I had lots of injuries, and it was a very nice kind of practice for that period. And then when I got into kind of like more mobility or like movement as a whole, I saw like, okay, it's much more like three-dimensional. I found yoga then there's very little to focus on like strengthening your back, your posterior chain. I found that was like massively lacking. And I was actually speaking at an event, and I'm not trying to bash yoga at all. I'm a huge fan of yoga. I was speaking at an event during the summer, and talking about like some of the frustrations that people can have as they have some sort of postural issues, or they have aches and pains and they're told to go to a yoga class, like they get tight shoulders or something like that, or neck pain. They go to yoga and it makes it worse. And then they kind of give up, or they just think there's something wrong. So can you maybe explain what's going on there, and what advice you'd give to someone who maybe they like yoga, but maybe what they can do in conjunction with yoga to get the best benefit from a longevity point of view, from a injury reduction and pain point of view as well?
Yeah, I think certainly in the yoga world, there was a belief for a long time that yoga fixed everything. And that, you know, if you had SI joint pain, you just needed to do more hip openers, or kind of these generalized ideas. And I love yoga. I will always love it. It was my first introduction to, you know, sort of a movement world. And the reality is there's no single activity or type of practice or modality or anything that covers everything. You know, there just isn't. So I think what happens is when people are told to go to yoga, often it's by their doctor. And so what I see with a lot of doctors is that they sort of fall into two camps. They fall into the camp of they've seen 90 million injuries from yoga, and so they're telling people stay away from yoga, it's dangerous. Or they haven't maybe, and so they're telling people go to yoga for it'll help you stretch out and relax and da da da. And in both cases, I think the missing link is that neither one sort of fully understands the breadth of the styles of yoga that are out there and how many different kinds of yoga there are available. And so they just sort of say, go to yoga, but they don't really know what they're talking about. Right. And so part of my job a little bit is helping people understand, you know, not all yoga is the same. And then it really is sort of a case by case basis, you know, depending on what's going on with someone's body. If they're really, really injured, or let's say, you know, if they have like a frozen shoulder, or they have some sort of like labral tear or something like that in their shoulder, I'm not sending them to yoga because there's down dog. There's a million times when you have to be on your arm, right? And in a sort of non one-on-one setting, right? So you don't have someone really paying attention to what's going on with you. But I do use yoga therapeutically in my practice with my patients all the time. And I know lots of PTs that do, you know, but it's kind of a mix and match, right? Because sometimes what this person actually needs is Pilates. I work with people who are incredibly mobile. Some of them are actually hypermobile, and, you know, they love yoga because it's like, yeah, I get to like put my leg around my head where it belongs, or, you know, it's just, you know, I'm a hypermobile, and yoga came very easy to me because all of these complicated, fancy looking things were basically not a problem. But that didn't actually help me in the long term, because that's not actually what my body needed. And the more I started to build more stability with both strength training, but also practices like Pilates that are all closed chain, and the reformer in particular, I'm a huge fan of the reformer, the more my body actually responded in a positive way. So the sort of prescription of go to yoga is a very, it depends kind of a scenario. But if someone's been told to go to the yoga and they went to yoga and it didn't help, or it made things worse, it may be either the type of yoga that they're going to is just far too vigorous for what their body needs, or in fact, yoga is not the answer and they need to be building strength, or they need to be working with in a private setting where someone's watching them move and seeing what's happening.
Okay. And then like, as it just, let's just take it as a, this is obviously, it's going to depend, but just, let's just say someone's listening, they're in their 30s, they're an office worker, they're pretty stressed, they get kind of upper trap pain and maybe lower back pain, and they want to do yoga to help alleviate that. But maybe what should they be doing in conjunction with yoga, or like what would be kind of like a nice balance? And let's just say it's hatha, or like a pretty low intensity hatha class.
Yeah, I mean, that's what I would recommend for somebody, is they did something like a gentle class or a beginner class, or even restorative is really nice. A lot of that sort of office worker upper body stress or pain rather is stress related, right? So if we can start to decrease their stress, get into some breathing mechanics, like they're probably not breathing especially well, and all of those sort of things might be addressed in a more gentle level yoga class. But they may also need to be doing more mobility work, right? If there's a lot of stiffness, I see often in that CT junction where your neck meets your body, right at that point, sort of at the base of your neck and the top of your trunk, is such a stiff area for people regardless, because the available movement changes very, very quickly, because suddenly now we've got ribs attached to the spine, right? And so you pair that with repetitive positioning in front of a computer, not a lot of variety in movement, in their movement, diet, so to speak. And there's definitely a lack of mobility. But the other piece that I really don't see being addressed all consistently, I would say, is that they may actually just need to get stronger, right? They may actually need to, because you can have a tight and achy upper trap that's actually not especially strong, and or any muscles in any part of your body can be sort of like tight and holding, but not a muscle that is functional, right? Not a muscle that's able to contract all the way and relax all the way. So it is kind of wild to a lot of people, but sometimes actually working on strength is a huge piece of getting them out of pain. I work with a lot of people who have neck pain in particular, because it tends to be really chronic for people. It tends to just be like, they'll come in and be like, oh yeah, I've had like neck and shoulder pain for 20 years, something like that. And I think we tend to feel very sensitive or wary about, doing things to the neck beyond, people, they're like, oh, well, I'm just thinking about one person in particular who, had gotten multiple chiropractic adjustments and did, massage and all this kind of stuff, and their neck wasn't getting any better. And I was like, well, you're having all these passive treatments happen to you, but there's nothing telling your brain to change anything about the way that your muscles are working. So until we start to teach the muscles what they're supposed to do, like what their actual movement job is or what their actual stability job is, there's no impetus for your brain to change anything about how you're holding your head. And it can be a sort of slow process, especially when people have become fearful about movement because they have pain, right? But ultimately, anywhere in the body, but especially I see this in the neck and shoulders, because it is an area that people tend to stretch or roll out with a ball or the Theragun or get a massage, but they don't tend to strengthen, right? And I've really never seen people get completely out of pain in a more permanent way unless they do some of that strengthening.
Yeah, I love the point you made there about a lot of the areas that we kind of gravitate towards. It's like, oh, I'll go to a chiro, I'll get an adjustment, I'll get a massage, I'll go and get Chinese medicine or something like that. And the fact that you're saying like they're all passive and you're not actually, so you're saying you want to actually signal to your brain that you want to change the tissue or the muscle fibers,
Yeah.
or is that kind of what you're getting at?
Yeah, that you're this idea, it's not an idea, it's this thing that happens in your body. It's motor control and motor planning, meaning, anytime you use a muscle, it's happening because your brain is telling your body to use that muscle. And it's happening so quickly, obviously, and a completely subconscious level, but that there is an actual sort of neuromuscular connection from your brain to your muscles. And if the message has consistently been, just scrunch your shoulders up a little bit and hold yourself like that all day because you're stressed, that's the message. That's what the brain is telling the body to do. And so it's just going to keep doing that. And then maybe you get a massage and your shoulders go back down and you feel like, oh, that's so nice. But there's no new messaging about what to do with the muscles. And so, slowly but surely they creep back up again. So it's really, it's a bit of a Band-Aid, and I'm super pro all things that help people with pain. I do manual therapy. I love acupuncture. There's all kinds of things that are really useful. So I'm not saying that's not appropriate. And especially if getting out of pain is the key to get someone then actually able to move, great. But you can't leave out the second part where they're actually moving, right? And you can't leave out the second part where they're actually doing rehab exercises or whatever it may be to then teach the brain. It's actually literally you're creating new brain pathways to your muscles. And the more that those pathways are reinforced, then the old pathway, the one that said scrunch your shoulders up and leave them there for 9 hours, it actually starts to die off. Brains are fascinating. So you really have to change your brain to change your body.
Yeah, that's super interesting. Even just as you're saying that as well about like the passive therapies, it's kind of a lot of you can't get away from doing the work essentially. Like
Yeah.
you still, and I think in society it's like, I'll just take a pill, I'll just go and get someone to rub me out, or, and it's just, they don't work, in any of these, in nutrition and in pain and strength, all these things.
Yeah.
With regards to the
Sorry, that's the dog doing something insane.
side of things. with regards to the neurological side of things, or from a psychologically, the term injury identity, is that something that you're aware of? I had a physiotherapist on a few months back, and he was saying that, and it's such a gnarly area, like pain science and everything. And he was saying how the physical trauma is gone and it's rehabbed, but you're still expecting to be like, where's my shoulder pain? and then you get it from a psychological standpoint. So is that a thing? If so, would love to hear your thoughts on it.
Injury identity is not a phrase that I'm familiar with specifically, but it sounds like, well, there's a couple of things. Chronic pain is a different thing than acute pain. And pain science to me is fascinating because again, it's really all about what's happening in your brain. And, an acute injury like a ankle sprain or like you tweaked something will hurt. And then as it heals, the pain goes away. And that's entirely appropriate because your body is trying to tell you, please don't do anything dumb here. Just please leave this body part alone. But in a chronic pain cycle, because the concept of pain is something that comes from your brain, it's not actually something that your body is generating. So if you have been experiencing pain in a part of your body for a long time, even when the tissue is healed, you may still experience pain, right? And that's that chronic pain cycle that then we have to treat in a slightly different way than just rehabbing the tissues, right? We actually have to get at the pattern of thinking. I have a story it's a bit extreme. It's a good story because I've never had anything like this happen, before or since, but I had a patient I was working with who had a disc herniation and they were in a lot of pain, and they would describe their pain as like 10 out of 10 on the pain scale, a 9 out of 10, just really debilitating. And we would have our session and they would feel better after the session. But then the next time they came back, it was right all the way back to where it was. So we weren't seeing any improvements. And, that's always a bit frustrating because my job is to help people feel better. So when it's not working, I'm always like, well, okay, what's going on? So finally, we had a conversation about this herniated disc. And the thing that a lot of people don't know is that disc herniations actually heal on their own. After about a year, they're scarred down. They may not have gone back to what they were previously, but they're not still injured, right? And so we started talking about how, the disc herniation happened quite a while ago and that the tissue itself is actually probably healed. And this patient was like, what are you talking about? And I was like, well, it's herniations heal on their own. And what came out then was that this person thought that the herniated disc was kind of like putrid inside their body. Like they had this rotten piece of tissue in their back. And that's what they thought was going on. And when I explained to them that that's not what was going on, they said, wow, my pain has gone down to a 5 just from a conversation.
Whoa.
Yeah.
Was that like literally at the end of the conversation? They're like, yeah. Oh, I feel 50%
They were like,
better.
I feel, yeah, because, and so this is why in that chronic pain situation, we really have to address the thinking and just the act of addressing the thinking and the person understanding. And so I explained how pain occurs and how your brain is making a decision about an event, a noxious event in your body, and deciding, is this pain or is this not pain? What does it remind me of? What is, there's so many different, aspects of the brain that are involved in the pain decision-making process. And so helping people to understand that just by explaining that it's not a one-to-one relationship of you're this much injured, therefore it hurts this much. When people start to understand that, that will actually decrease their pain. And it's one of my favorite things to do is help people that way. And even when it's not as extreme as this example, I've had other people that I work with where we talk about this. And then the next time I see them, they're like, I had my pain, but I just thought, you know what, this is just your brain saying that it's pain and it's not actually happening. And they're like, and my pain got better, so it's such an easy trick is the wrong word, but as a tool, certainly within the scope of what you feel comfortable talking about and your own, personal knowledge. This is sort of like all the movement teachers or whoever might be listening that is in a professional capacity, just explaining to people how pain is perceived and experienced and how what their brain is telling them about their pain. And again, this is for chronic pain, not for like a specific acute injury, but that can really, really make a huge difference in how quickly somebody feels better.
Yeah, that is so powerful. And it's like, especially what you're saying about the herniated discs. So I guess 2 things I'd like to talk to you about with this, and it's kind of the pattern I see with my own clients, and I see how beneficial it is. And I think it's kind of intertwined in that we really focus on environmental factors and like how you're spending your day, all of these things, which tends to give the person more kind of control or ownership, or like they're taking action on the things that they've control over. And that seems to kind of also help them from a mindset point of view, which I think kind of leads into what you're talking about. So you've got that direction on one side. And then on the other side, you've people who will go to, and again, not to bash GPs or anything, but you'll go to GPs like, oh, you've got this damage, you need to go to the surgeon. And the surgeon's like, you need surgery. And it's like, that's like, there's no discussion about maybe we'll try this first. It's like surgery. So like, yeah, I would love to hear you kind of explain maybe both routes. And because I think a lot of times it could be just a lot of people exploring the environmental side, the mindset side first, and then I think surgery is definitely something that people need sometimes. But yeah, I would love to hear your thoughts on that.
Yeah. I have a bunch of things to say about that. The first thing I would say is, as the GP, it's very satisfying to have, an MRI of somebody's back and to be able to point at a herniated disc and say, this is why you're having pain. And it makes sense to them. It makes sense to the patient. At least here, I'm seeing more and more people then prescribe physical therapy before surgery, because there's a lot of research that's come out where a lot of people have some kind of surgery, on their low back or their neck, and it doesn't take their pain away. It doesn't help, right? So the tissue's been fixed, but the pain is still there. So then we have to sort of start to recognize like, oh, yes, there's pain in this area. And the jumping off point may have been this herniated disc, but this herniated disc itself is not creating the pain anymore, right? It's the response of the body around it. And there's all kinds of research. It's really fascinating that they'll just grab random people off the street. And the only through line is that none of them have back pain, but all ages, all fitness levels, and they'll do x-rays and MRIs. And it's a stunning number of them have some sort of tissue damage. They have a herniated disc, or they have stenosis, right? Narrowing of the bone, pressing on nerves, or they have something, quote unquote, wrong with their spine, but they don't have any pain. And, research is considered good research when it's replicated multiple times. And so this has been replicated multiple times, and they're finding the same things over and over. So it's a really big mind shift, and probably quite a bit of cognitive dissonance for a GP to have to say, oh, well, this like A to B, herniated disc equals pain equals you need surgery. I have to actually consider a different component that I don't think about a lot, which is movement, right? And that the pain that this person's experiencing is not necessarily going to be fixed by surgery. And then to the point that you were talking about with the environmental concerns, there's something called the biopsychosocial model, which I don't know if you're familiar with, but this is this sort of like more holistic approach. So the bio is obviously like what's actually happening physiologically in the body. The psycho part is what is happening in your brain, meaning like how do you classify this pain? What does it mean to you? What is your general mental health even? How is this something where, like, for example, for me right now, I've sprained my ankle. I can't ride my motorcycle. I love riding my motorcycle. It's one of my favorite things in the world to do. I know, because I've studied this enough, that eventually my ankle will heal. I will get back on the motorcycle. But for a lot of people, there's a lot of stress and anxiety around things like, will I ever do it again? Am I injured for life, right? And that all of those thoughts can make your pain feel worse, right? So psycho, and then the last part is social, is your environment. What is your support system? Do you have a community of people? Are you very sort of alone? Are you stressed in your life, right? So all of those components play into people's experience of what they're feeling in their body. And I've definitely worked with people where we've done a bunch of PT, and actually, as it turned out, they did need surgery, and the surgery did make them feel better. But I've also seen plenty of people who come to me after having had surgery who will say, I had surgery and it feels the same, So I think, and I can only speak for what I'm seeing here in Los Angeles, and it is a city with a lot of sort of very forward-thinking medical professionals. But even here, sometimes people are just getting told to have surgery. But I do see more and more, especially in the orthopedic surgery world, that people are sending people to PT first, and recognizing that that's actually probably what's going to get them better, and that they don't need surgery.
Yeah, that's really good to hear. And yeah, I guess like Los Angeles is going to be the first place in the world that's going to be doing this stuff. But yeah, I guess what I'd like to see more. And of course, it's hard if someone's been in a job for 20, 30 years and that's always what they did to kind of change. But it does frustrate me when you would sometimes say, well, let's maybe try this for 3 months or 6 months and see, and then we can go down the route of surgery if it doesn't work,
Right.
Okay, so let's talk about I've got a few guys who we're colleagues, I guess you could say, but they're physiotherapists, and we talk, and personal training, so PT for us is personal training. For you guys, it's physical therapists. But like from a legality point of view, I was really surprised on the differences. As a personal trainer, you can kind of say anything.
Yes.
It's so, and it's a good thing and a really bad thing about our industry. In like the barrier to entry is zero. You've got a lot of extremely unqualified people, with big followings giving a lot of advice, but then you also have a lot of people helping a lot of people. So it's really, really, good and bad. Physical therapists, especially online and like from a legality standpoint, I'm not sure I'm guessing it's the same in the US as other parts of the world, but like you guys need to be super careful about what you're saying. like from a marketing standpoint, all of these things. So how do you navigate that with your own business, specifically now being online and using online platforms?
Yeah. I mean, it is funny because it's the same here, where trainers, but also any yoga teachers, Pilates instructors, there is no licensing board that you are a part of. Like I have a PT license for the state of California. And if I do anything that broaches the legal boundaries of that, I can have it taken away from me. And then my only option is move to another state, take their licensing exam, hope that whatever I did wasn't so terrible that I'm just barred for life anywhere, right? But yeah, you do have to be a lot more careful. And so the biggest thing for me is I try to avoid anything that is on in any sort of online stuff that I post. I'm not prescribing anything because I can't. It's so the things that I do post tend to be like, hey, here's this cool movement thing. It felt really good when I did it. Give it a go and see what you think. Full stop. But I'm not saying like, if you have this kind of pain, this is the exercise that will get you out of pain. And there's definitely some PT people who are doing that. And you still see this sort of like, try this one move to cure, help all, whatever, back pain. And I think that's more of a buyer beware sort of a situation. Anytime I see anything that starts with this one trick fixed my neck or something like that, it's just a quick scroll past because I'm like, well, no, it didn't. I mean, maybe it did for you. So I think for people who are looking, because there is so much, and it is sort of a tough situation because there is so much great content on the internet that's actually, and on social media, that's actually incredibly useful. And like I said earlier, like I just sort of look through and I'm like, oh, that's really cool. I'm going to try that and see what that feels like. And maybe I'm going to use that with this patient. But you really sort of have to have an eye out for what's this person trying to do. And what was that guy, the Liver King? Lots of people I
Yeah.
saw writing about him. I had never heard of him before, thankfully. And also, liver is disgusting. Why that part I'm like, ugh. But someone like that who then turns out the story was that he claimed he wasn't taking steroids, but he actually was. Is that correct?
Yeah, like everyone was, well, it was like, well, he's definitely taking steroids. It's only a
Yeah,
matter of time because he's
just
just
look at him.
jacked out of his
Yeah.
mind. And he's like a 45-year-old guy with multiple businesses and like two or three kids.
Mm,
So that's just not humanly possible. But yeah, it all came out 2 or 3 days ago and
yeah,
now everyone's talking about it. So he like,
right.
because he grew from, I think it was July 2020 or 2021, even like it's a year and a half, and he's built
Hmm.
like 1.7 million followers, which is
Wow,
pretty phenomenal.
that's wild.
Yeah.
Well, that'll be interesting to follow. But also, there's definitely been accounts that I'm like, oh, this seems like maybe it's good. I'll follow them. And then as I'm looking at what they're posting, I quickly realize that it's actually not good. Like there's one in particular, I can't remember what it's called, but I don't want to call them out anyway, just because it's a bit rude. But one of the things that they were showing sort of like, do this move to, put your SI joint back in place. And then it had sort of a sound effect. And I was like, whoa, that's really intense. And then they did a completely different video about your low back and they used the same sound effect. And I was like, oh, so that sound didn't actually come out of that person's body. They're just adding it in. So this is nonsense and like unfollow time. So, I think, to go to your question about like, how do I make sure that I'm sort of staying within the bounds of what I can do? I just basically, I never prescribe anything for anything. So I'm not like, this is going to fix your neck, but I'll be like, oh, for example, be like, oh, I woke up with a crick in my neck. Here's some things that I tried. It felt somewhat better. You can maybe try them, so you have to be very kind of general in your language. And I would say anyone who is not general in their language is just trying to sell you something.
Yeah. Yeah. Good advice there. What are your approaches to, like, obviously you're a doctor of physical therapy, so you're very much research based and evidence based, but what are your approaches to evidence based versus like anecdotally doing things that aren't yet researched
Yeah.
or have enough backing behind them, but you kind of see like, okay, this stuff does work.
Yeah.
Or at least you think so. Like, what's your approach there, and what's your advice there for people?
It's the way that we're trained here as PTs, we're trained to sort of take a three-pronged approach. One of the prongs is evidence. What does the research say about working with people with this condition? One of the prongs is clinical practice, or it's called something else, but I don't remember. But it's essentially, what have you seen when you've worked with patients in the clinic that actually works? So that's sort of, I guess, that anecdotal part. And research moves very, very slowly. So that's a bit of the problem. If you're only evidence-based, you're probably missing, well, you're missing two of the other prongs of the approach, but you're also missing the kind of things that people are discovering now. And now is sort of like, in the past 5 years. It's not like this month, right? And then the third one is patient preference, which is kind of funny, because that is something that's going to help somebody get better, is what does this person want to do, or what are they willing to do? And there are circumstances where, let's say a patient comes in there and what their preference is that they lie down for an hour and I massage them, right? So sometimes in that category, I have to say, well, this is, it has to be a little bit of a compromise. Like, we'll do this. And then what I'm going to have you do is this, where I'm going to have you get up and do some exercises, because that's, from my experience, what's going to help you get better. And so sometimes with my more savvy patients clue in pretty quickly that I'm negotiating with them, or that I'm making it sound like they came up with the idea, but really I came up with the idea, but that is sort of a trick that I use a lot of the time, where it's not this kind of like, I'm just, ortho broing for sorry, as I speak to a bro, but there's sort of I have to just sort of take an aside. In Los Angeles is USC. It's the University of Southern California. They have the #1 PT program in the world, and they're not shy about telling you about it. And that's fine. But they have also spawned, a group of people I jokingly call ortho bros, which are just sort of like, oh, you do the test, this hurts, therefore that's what's wrong. Therefore it's this muscle, release this muscle, give them this exercise, goodbye. Like, it's sort of very, it doesn't take the person in front of you into account. It's not very holistic of an approach. And so that is always, in my opinion, that's always going to miss something. But so is only being, the person. What is this? Oh, they just want me to massage them. Great. Oh, okay. So I'll just massage this person. Like, there's a in between, right? And so negotiating that in between and finding where is the point where they're getting some of what they want, but I'm also making happen what I want, because I know that the part that I want to happen, which is usually the movement or the strength, is what's actually going to make things change. But, I give them a little bit of what they want, and then I make them do what I want them to do. So you really, evidence is great. And there's lots of things that I use from evidence, but you can't also, you have to include then what you've seen really work for other people, and you have to recognize the person in front of you. And in particular, I mean, I don't know if you do this in the training world, but I give people homework, because I might see them once or twice a week, and then the rest of their week, they're just doing whatever they're doing. So, I give them movements that I want them to do at home, maybe with a TheraBand, or maybe, some yoga poses or something. But I also really specifically discuss that with them and come to a realistic agreement of, like, in your day, if I gave you 3 things to do at home, would you be able to get that done in a day? And or is there one thing, or if it's every other day, because people are busy, and I'd rather set them up for success and give them an amount of homework that they can do than just be like, here's 10 exercises, do them every day, because that's instant failure for some people. There's such a barrier to entry. They're like, where is this? It's, magical half an hour that you're telling me I just have to find in my day, and that, obviously speaks to how we're all way too overbooked and too busy. But my perspective is like, I'd rather know that I gave you 3 things, but you're actually doing them every single day, than I give you 10 things and you come back next week and you were like, I couldn't do it,
Yeah, that's so true. And like, I love that three sided approach, like the evidence base. It's kind of like you have the knowledge, and then the anecdotal is like you have the experience, And then the patient is like you have the coaching or the interpersonal skills to actually combine them and get them across to someone so they can actually apply them. And like you're saying, if that's basically coaching, like well, I've all of these ideas in my head and things, but like what can you realistically do each day or each week? Because that's the most important thing. If someone's like, I can give someone the best meal plan or the best rehab or the best program, but like it's only good if the person actually takes action on it, right? So I think that's definitely lost on or I think it's something that as a coach, I think you learn more the longer you're in it. It's about understanding like people have lives, and like when you're a coach or I'm sure it's the same for you as a physical therapist and a yoga teacher, you love movement, you love learning about it, you love nerding out about this stuff. And it's like, well, I guess everyone's like this, right? Everyone just does this as a pastime, but like most people don't really, they mightn't even
Turns out,
enjoy
no.
sweating. Yeah. You know, so I think that's a really powerful question, like what you're saying, you know, what can you actually do? And a question I like to ask my clients is like, okay, let's just talk about your hell week, you know, and just getting into kind of future cast life, because you're going to have really bad weeks. That's normal. You might have a bad few months. So like on your hell week, you're sick, your kids are sick, work stressful, the economy's crap and the weather's bad and your knee hurts.
That sounds terrible.
Yeah. It's like,
I'm
what
gonna
can
get
you do?
under the covers. That's what I'm gonna do.
Yeah. And I'm like, what can you do in that week? And they're like, oh, I mean, sometimes people are like, oh, I can still do 4 days. I'm like,
That's
okay,
impressive.
we're gonna do 2 days for 15 minutes. And that's your floor. That's your weekly floor. And then it just teaches people like to sustain the consistency of moving every single week all year, instead of just being like, oh, I can't do my 4 hours of training, so I won't do anything this week, or I'll start again when life calms down, which never happens, right?
Or January. January is a super popular time for people to
January's
start.
magic.
Yeah.
Mondays in January. It's the best.
They're the best. But February, forget it. Yeah.
And then February,
Yeah.
it's just like
It's
we'll
just
wait
like,
till next January.
exactly. And I
But
think I
let's
just
sorry,
sorry,
yeah, jump
it
in.
just makes me think about something that I've sort of been, for my own movement practice or whatever you want to call it, lately been thinking more about. Was I had a patient, I was working with him and I sort of mentioned in passing something about like, oh, this, you know, we were doing some sort of stretch or something. And I was like, oh, wow, I should be doing this more often in my own practice. And he then said to me, he was like, so this doesn't end. Like, I mean, the rehab part might end, right? But there is a through line of kind of like maintenance for your body. And then depending on what you're trying to achieve, if you're training for an event, or if you want to get a pull up or whatever, right? There's certain things that you might be working on, but it does help to think of it as this is a lifetime activity, so that in the periods of time, like, for example, we just had Thanksgiving here, which is a big holiday where everyone sits around and just eats tons of food. And then it kind of like slides into Christmas, which is more sitting around and eating a lot of food. And I think that's part of why, you know, everyone loves January so much, because it's like, well, I'm just going to let this all slide for now, and then I'll start up again in January. And I actually, to be perfectly honest, I think that's fine, because if I'm looking at this from a lifetime, you know, a lifelong, you know, perspective, what does it matter if 6 weeks, 1 year, I wasn't so good at it, you know? Or if you've had a surgery and you're recovering from surgery and it's multiple months, and then you're going to have to get back into your practice, it can be very, if you're someone who is used to moving a lot, it can be very tough psychologically, because it doesn't feel good to not be doing what you like to do for your body. But it's this idea of like, oh, how am I ever going to get back to where I was? You know, I'm so deconditioned now and all that kind of stuff. But ultimately, we have to sort of look at it big picture and be like, this is a commitment that I'm making to myself for my life. And I really love this idea that you're talking about of like, the floor is this amount, you know, it's 15 minutes twice a week, because then from there, you're always succeeding, right? Most people can fit in 15 minutes twice a week, even in their, you know, even while they're between eating, you know, another mince pie or whatever. So the idea that it's like, well, it doesn't, I don't have to give up completely, but if I do, it's not a reason to like start shaming myself about it. And just sort of thinking about movement as something that is just as important to your life as how successful your career is, or the how your kids are doing, or how your partnership or your marriage is going, or how you're eating, or all of those sorts of things, right? It's just as important.
Yeah, that's such an important point to make about it just being one of those big rocks in your life. And I think because fitness is so all or nothing, and it's also very much shame based, it can be I'm either all in 6 times a week or I'm a failure.
Right.
And just get a lot of times just talking to clients, but like, hey, how do you feel about doing like 2 days a week? They're like, oh my God, I feel like that's taken so much pressure off my shoulders. Just sometimes just a professional telling them like, hey, that's actually okay. Because a lot of the fitness industry is like, you don't want it bad enough, if you're not doing like 5 days a week. One thing I'd like to ask you as well is like, what is something or some things you've changed your mind on recently? And by recently, let's say the last 2 to 3 years.
um that's such a good question. I definitely, for a long time, I have definitely felt the sort of passive versus active in terms of what people need to actually rehab. But more recently, that active part, I've started to recognize has to, for a lot of people, needs to be in the category of strength training. And so the parameters for strength training, in terms of like sets and reps and all of that kind of stuff, like it can't just be I'm using the yellow TheraBand, like the lightest possible TheraBand, and I'm just kind of moving this part of my body around. Initially that may be the case, but the actual strength component really does need to come in at some point during rehab, possibly quite near the end, but it can't be left out. And I think one of the things that I've started to focus on more is that's including the strength part in a really sort of specific way, but also seeing that as the completion of the rehab. So the rehab is not just complete because they don't have their pain anymore and they have their full range of motion anymore. They have their full range of motion. They can do whatever their activity is. To me, it's really much more about there has to be a strengthening component for this person. And it doesn't have to be like say you have a shoulder injury. It doesn't have to just be about like doing shoulder strengthening exercises. Really, the completion of rehab is connecting that shoulder strength to the rest of the body, because now I'm resetting a movement pattern by re-educating the body that, like, if I'm doing some movement with my shoulder, it's actually going to relate to my opposite side hip through my core, and I need to be training activities that do that. So I think that's the thing that I've really started to hone in on more, is that it's not enough to get the body part feeling better and to get the range of motion and the sort of basic function back in that body part. You really have to actively add on the part where you connect it to the rest of their body, and that there does need to be some actual strength training component pretty much all the time, is what I'm finding.
Yeah, no, I love that you've said that. And I think a lot of times people can be perpetually in that rehab state, and then they never kind of build the capacity to get beyond the injury. It seems they're just barely getting out of it, then it goes again.
Yeah.
And I really like what you said as well about, you build the rehab, then you build the strength, and then you actually improve the movement capacity and the ability of that area. And it's what we do as well with clients. If they have like a shoulder injury or something like that, is we work them towards skills that are going to be demanding on that area. So an example would be like someone's got a shoulder issue or an elbow issue. I'll get them working towards like a handstand or a muscle up or a chin up. And then they're like, oh, wow, my elbow is bulletproof now, or, whatever term you want to use, because like I'm doing this really demanding thing that would have, destroyed my elbow or shoulder 6 months ago or a year ago. So yeah, it's very cool that you're talking like about a very similar approach yourself.
Yeah.
What would you say is the most common trap or traps you see with clients? And again, I'm sure there's lots of maybes and it depends, but like if you just want to think about your avatar is someone in their 30s or 40s, they're stressed, they've got a busy job. Um, what sort of common themes do you see happen with that sort of regular everyday person, and what advice could you give them so they have like a nugget to take away from listening today?
That's a really good question. Uh, I think it's a few things. I think it's, if it's someone if we're coming back from an injury, understanding that it's not just like when I take my car to the mechanic and he says, well, it's your discombobulator and that's $800. And I just kind of go, okay, because I don't know anything about engines, embarrassingly. And so they could tell me anything and tell me somehow it's always $800. I don't know why, but that that it's a team approach, right? So in physical therapy, in training, all of it, this is not something where you just come to physical therapy and you do what I tell you for the hour and then you go away, and that's not going to be enough. And so I really sort of drill it into people from the very first meeting that they are going to have homework to do. And I don't, I just sort of frame it as the people that I see who are most successful, who get the most quickly out of pain, are the people who do the homework outside of the clinic. And the people that I see it's not that it won't necessarily, but the people that I see that takes longer and longer and longer are the people that only show up here and they're not doing anything else. So that's a big thing that I see that people just sort of often need to understand, is that it's not like you're going to the dentist and they're cleaning your teeth and then you just do whatever. I guess that's not true because you are supposed to brush your teeth in between, but that there's actually like stuff that you are supposed to do on top of just going to therapy. And then also, I think as well, and this is again just something I've started to really, explain more to patients as well, is that a lot of people rehab sort of 75% of the way. And then as soon as it's not hurting anymore, they're like, I'm done with rehab. But there's this last piece where it has to integrate into the rest of the strength of the body. A lot of time when someone's injured, they've created a compensatory movement pattern around it. And then after the healing is done, their body doesn't automatically go back to where it was before. In fact, most of the time it doesn't. So you still have this compensatory pattern. And that's usually why the injury happens again and again and again. So that it's very tempting to stop once you're out of pain. And especially if you're like, well, yeah, this has been a time commitment it's been difficult. I have to set up, nannies for the children, and I only have this 1 hour. It's like, it's tempting to be like, as soon as it's better, I'm out of there, right? But recognizing that there's this last sort of bit of it that if you don't do it, this is going to become a recurring issue. I think those are sort of the two big things that I at the moment I'm really sort of it's spending a lot of time explaining to my patients and getting their buy-in, because then it's
Yeah.
not.
Yeah, I like how you frame that as well. Not like you have to do this if you want to be okay, you need to do this. You're like, well, look, in my experience, people who get the best results, they generally do X, Y, and Z. And you're kind of just explaining like this is the path and they can go
Yeah.
down it. You're not
Yeah.
judging them or anything. I really like that framing. And then would love to know like about that compensatory pattern. Like if you were saying like overall percentage, what percent of the recovery would that last bit be, if that makes sense?
Yeah. That's, I don't know, but in my I think people usually get sort of 75% better if they don't then do that last piece. So maybe it's like 25%, but maybe it's more than that. I don't know. I mean, the one thing that is often challenging to have people believe is that actually strengthening something could make it hurt less. So sometimes it's more about, because it is always this negotiation of you and the person in front of you, sometimes I probably could be using like actual strength training parameters earlier on in their rehab, but the person in front of me does not want to, or they're afraid of it because they're afraid that it's going to hurt, or for whatever reason, it's they haven't quite gotten to the point where I've demonstrated enough to them that I'm making them better. So something that sounds a bit crazy to them, they're just like, no. But I would not be surprised if introducing, some real strength parameters even earlier than that sort of like last 25%. Like, let's say I'm seeing somebody for 8 weeks and in the last 2 weeks, we start to do the strength or something like that. I wouldn't be surprised if it's actually way more useful much earlier, but it is still going back to that three-pronged approach where you have to take everything into consideration, including what the person in front of you is going to do. And I just find that people, I just get so much better buy-in from people, and when I explain what I'm trying to make happen, but also when I give it to them as an option, and then they get to choose it. And then also that way, when if they don't choose it, and then later on they're like, well, why isn't my shoulder better? I can refer back to like, well, remember when we said at the first meeting that like the people who get better faster, right? So it kind of shifts the blame off of me. If I'm
That's
like,
very
well,
smart.
I told you what you needed to do and you didn't do it. So not my fault.
That's great. Awesome, Sarah. Well, look, I'm conscious of your time, so I really appreciate you taking the time today. I've learned a ton from you on today's session. If people want to learn more about what you're about, what sort of things can you offer? Would love to hear more about, where people can find out more about you if you want to talk about websites, social media, all those things.
Yeah. Thank you. So, and it's been, like you, I am a total body. I would sit here, I would talk to you for like the rest of the day, because this kind of stuff to me is just so fascinating. And I, similarly, I'm like, why? You mean other people don't think about this all day long? They don't wake up thinking about like, the mechanics of the knee or whatever. But anyway, so this has been really enjoyable for me as well. Thank you so much for having me on. And I am on basically only Instagram because my mental capacity for social media expands to one platform and one platform only. And so I am Sarah Court DPT, which stands for Doctor of Physical Therapy, on Instagram. And then my website is also sarahcourtdpt.com. In terms of what I do work-wise, I have a series of tutorials that I do with my genius friend, Laurel Beaversdorf, and it's called Movement Logic Tutorials. And that is also, that's the Instagram handle and also the website. So if people are looking for tutorials for specific parts of their body in terms of like, there's yoga, there's some mobility, there's strength, there's all kinds of things in there. That's an online product that we have. I do private sessions with people over Zoom. I do them in person if people are in Los Angeles. I work at a clinic as well. And I'm just sort of, there's a few projects that I'm working on for next year that I'm really excited about. So, if people start following or get on the mailing list for my website, they'll be able to see what's coming up.
Awesome. I appreciate that. And I'll put all that in the show notes. Okay.
Thank you.